Welcome. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber. Thank you for joining us for the February 25th Cross-Industry Update with Boulder County Public Health. I want to thank you for continually coming and joining us every week. We draw really good numbers still every week, and we have really good questions. In between sessions, remember, you can email questions, you can call, but if you have questions on this session, please put them in the Q&A feature, not in the chat. I will ask them on your behalf and try to get as many answers as we can. But first, let's hear from Lane Drager at Boulder County Public Health.
Thanks, Corinne, and thank you all for joining. I'm going to do a very similar agenda as we have for the last several months. We'll give you an epidemiological update, talk a little bit about where we're at with the dial and status and what we know currently. Give you a little bit of some metrics from 5-Star and let Corinne share some of her insights there, and then have plenty of time for question and answer. Boulder County currently still in the yellow. We're continuing to see positive trends. Just the downward movement of case counts is not dramatic, so we're still solidly kind of in that yellow area. Specifically, that 1-week cumulative incident rate, we're creeping down, but just slowly. So we were about 116, I think, at this time last week. Now we're at 103.3 as of today. So again, still in the yellow. Positivity, that very, very favorable. That continues to drop. We were at 3.2% last week, which was still blue, and now we're even further into blue, 2.6. So very good there. Hospitalizations, this one kind of fluctuates a little bit, but I think we were about 7 days last week. As of this morning, we were at 8 days of decreasing or stable admissions. So again, fairly good metric there. Overall, this is that curve since the beginning of the pandemic of where we're at. We continue to come down, just not dramatically as we went up. So we're seeing about 53 cases per day. We were about 55 last week. So again, dropping, just not dropping at a dramatic pace. Similarly, we've shared this very busy slide, all the different colors of the counties. Same trend really across the whole metro area. So again, very good sign. I know some of the counties are actually starting to get close and moving even into the blue dial phase. Relating to our county case counts, you can kind of see our trends are still fairly similar of where across the municipalities the cases are coming from. About 149 City of Boulder cases, 96 Longmont, 40 Lafayette, Louisville, Superior, and then 63 for the unincorporated county and other municipalities. So overall, a similar kind of trend as we've seen. Getting back to our race ethnicity disparity, that one's still existing as far as where we're seeing case counts, and again, much higher than should be representative of the population for our Hispanic and Latinx community. Here's our vaccination counts. So those that have received a single dose and those that have received a full course, bringing us to a total of a little over 50,000 residents have received at least one, if not two vaccines. So continue to do fairly well given the amount of vaccine that we're receiving. So that still continues, as we've said, week in and week out, to be our big limiting factor. The metrics that are relevant to 5-Star and obviously for where we're at in our phases, we have, as I think we reported last week, and now we continue to increase that number of how many 70 plus have been vaccinated. We are closing in on 80% of our 70 plus population. So we are already over that. So that is a good sign. Sorry for going crazy with the scroll on my mouse. And here's kind of the metro area. So again, the statewide has still not hit that 70% and this is not the whole state, this is the metro, but that's fairly representative of the state, given that almost the entire population of the state lives within kind of that metro area, is about 66.7%. And City and County of Denver is the one that's sharing kind of this information, so that's very helpful. So that's our best metric for getting a gauge on where we're at statewide. So still haven't hit that mark, but hopefully by next week, if things go well, no more winter storms delaying vaccines and things like that, that we'll see that happen. So again, Boulder on this of all the colors is red, so we're doing really well, really near the top, and then all the other counties are kind of trailing a little bit. Here's the link that I just mentioned to that, where that graph can be found, and where Denver is sharing some of that statewide 70+ vaccination rate. Again, key takeaways, we're continuing to see case levels drop, just not at a dramatic fashion. Positivity rate also dropping. So those are both very favorable to us in looking at the dial status. Vaccines keep increasing those numbers. So that's, again, very good. So we've got that 50%. This actually, I just updated that one. So this is as of Monday, and I just gave you what I got this morning. So again, almost 80% there on the 75+. But it can continue to see those disparities. We're working to map those locations of where we're having problems so that we can do more targeted vaccine clinics for our disparate populations. Link to where you can get more info on the dial that has your sector specific, all the other counties. You can dig in to any of those that are helpful to you. So this, we still haven't gotten the performer side of this, but we believe that's where the dial update is going. There was a clarification that athletes and the audiences can be 12 feet away from the athletes. And it seemed consistent that that would be applied for performers and other people that are entertaining audiences. But we still are waiting for the performer side of that. It has only been given for athletics and athletic events. Sporting events without spectators do not have to be 50 feet apart. So there's sort of an outdoor event sort of stacking, as we've seen with soccer tournaments and things like that, where when they had spectators, each of those events needed to be 50 feet apart. When there's no spectators, they do not have to have that same 50 feet of separation. So for soccer tournaments that are not going to have spectators, they can have the matches, and other sporting events. They can do that without having to have that 50 foot of separation. So if there's anybody on for kind of Parks and Rec, hopefully that helps you. And we are expecting clarification from the governor. We understand that there's likely going to be a press conference probably tomorrow, where he's going to update the vaccine phasing. That likely will have significant impacts, but we don't know what that is for sure. So we can't speculate and say which groups will be in and which groups will be out, but stay tuned as we get more information. I know Corinne has been great about sharing things very promptly. Want to dig into the 5-star. I'm going to share just some metrics that were shared with Corinne and I, and then she can give you some more updates. But here, this is as of Monday, that 45 audits had been conducted, 35 businesses certified, and a few just in the queue. You can, maybe when you get the slides, you'll be able to see this. This is kind of small, but this is a breakdown kind of business ownership from minority women-based to none of those, and the majority are not minority owned, but we do have some that have come through. And then this color wheel down on the bottom is breakdown by municipality. So majority in Boulder, and then blue is Lafayette, yellow is Longmont, and Erie is the light blue, and Louisville is green. So that's kind of the breakdown there of by municipality. Corinne, any other kind of 5-star updates you wanted to share?
No, but the 5-star site does list the businesses that are 5-star certified, and the 6 audits that were scheduled were also certified. So we're up to, I believe, 40 some odd businesses that are all on the website as certified. Continue to apply, please. We have inspectors available to do the certifications. and we're sending out. We're going to start a social media campaign highlighting the businesses that are 5-star certified. So please know that we'll be starting some public-facing programs to allow consumers as well as employees to know which businesses are 5-star certified. Lane already said that we're at 66% of the statewide 70+ metric. Again, it needs to be at the 70%. We're hoping that we hit that in the next week. And then our businesses, when we get the green light, we'll let businesses know that they can start operating at the blue level. And with restaurants, this does include being able to do last call 1 hour later. So that's been a question I get a lot. It's not just capacity, it's some of those items as well. If you have any questions, just please reach out. But this is a great idea of, we've had everything from manufacturers to restaurants apply for this and get certified.
Thanks, Corinne. We've also shared this on a weekly basis, but if you haven't been with us before, this is an important tool to help quickly identify cases as well as get you an alert that you may have been exposed. It's a pretty simple app that you can download. It's not retaining your information any more than I think anything else, but it's not feeding in who you are to anything. It's really alerting you that someone that you were within proximity to ended up positive, and then that is something that's going to give you that quick reference. So a good tool, and really encourage folks to download that. This is, again, our weekly schedule. We haven't had any specific issues, so we have not had a Friday session for several weeks and do not have one scheduled this week. The Latin or the Spanish language session hosted by Latino Chamber has been recorded, so that one will be out and available. And then obviously you're at the 1 o'clock Thursday general update. And again, here's our contact information for our business team, as well as the number for the call center if there's questions or complaints that people have as well. And with that, we can move to questions.
So I know that you mentioned that there will be updates and clarifications around the move to 1B3 in the vaccine schedule. And most of that will probably come out in the next day or so with the governor's press conference. Again, I put in the email today that stage starts March 5th. There's going to be further clarifications. We've heard rumors there may be some additional expansions within that section. But this question is around whether or not Boulder County is going to be working with employers to try to set up vaccinations as groups, or if it will be up to individual employees to vaccinate separately. Apparently, Weld County rolled out an employer model this morning, and there's a question about whether Boulder County will be trying to model similar efforts.
Again, I'm not familiar with what Weld County is doing. I can just tell you for the phases that we've already been in, we have worked with school districts and all the different schools. We've worked with child care centers. We worked with our emergency responders. We also have, again, a large network of providers. So we are trying to make those connections and figure out who can handle what capacities. And then again, it's based on really how much vaccine we're getting. So I think the big concern will be if the governor announces significant additions to the phasing, that we will see an even bigger disparity in the number of vaccines we're getting for the population that needs to be vaccinated. So we will continue to coordinate as we have with our providers, and again, hopefully that we're going to get vaccine. We're hoping that Johnson & Johnson vaccine starts rolling out, because that will increase the supply. It's also a single vaccine, so for those populations that are more difficult to get vaccinated, it'll be a single shot and they will be done. So,
and some employers already have existing relationships with healthcare providers due to insurance, or some local, hospitals and providers. So there are those existing relationships that are available, and the provider list is on Boulder County's vaccination site as well. Another question about vaccinations. Most of our staff have been vaccinated. They're asking if they can be in a room together without masks since they've all been vaccinated. Is this acceptable?
No. So it doesn't remove all of the social distancing and masking requirements. It should help with overall immunity for those individuals, but again, it doesn't open up for everyone to kind of go back to normal yet.
And the key to that is also most of our staff, and there's still no proof that they can't be carriers and also give it to others. They just won't get as sick or necessarily be hospitalized. There has been no cases of that, correct?
Right. Yeah, and it's a very high efficacy, 95%, but that means 5% potentially will not have any immunity from the vaccine. So again, it's not 100%, and we know that not everyone is getting it, including, it sounds like, most but not all of the staff have it. So
And the orders are still in place, the masking orders are still in place, and there are no exemptions on the masking order that say except when vaccinated.
correct.
If someone's been vaccinated and they've potentially been exposed, do they need to quarantine though?
That will be a case by case piece. There are definitely situations where that will be needed. So our staff that are doing the contact tracing and investigating will work with all those folks and get a feel for what their job is, what their role is, and where there may or may not be need to quarantine.
So, there's a question, some employers may be having, clinics, but an example was given of maybe one of the healthcare or one of the school districts saying that if a teacher is able to get it on one of the other lists they're on, to not give up that to get it first on whatever list they're on, and not give up spots to get the vaccine is what this person's saying. So if you're on multiple lists, what should you do?
Well, ideally, make sure if you are on multiple lists that you're notifying whoever that you don't need the vaccine. So if you get it first from whatever provider, don't leave the other appointment so that they think you're showing up and then now they have vaccine that they're going to have to struggle to use. So that's the big concern of people being on multiple lists. We're again not necessarily telling people that it's forbidden to do that. Obviously, if they have a chance to get it somewhere else, just make sure you close that loop and don't leave that vaccine so that now the provider is struggling to try to figure out how to administer it when they're planning for you to be there. I guess just to come back to some of the questions on going back to normal with vaccine. So the concern is we have new strains that are coming out. And so that's another concern about what the overall efficacy will be, and the potential for further mutation. So we really want to ensure we prevent the spread of this as much as we have been already, because that's how it's continuing to mutate. So we really need to try to get this vaccine out there and really see that that spread dropping to almost nothing, so that we don't continue to have the virus mutate to a point where now we're starting over again.
Okay, I don't have another vaccine question quite yet, so we're going to move to some clarifications. Have there been any adjustments to the percent occupancy for retail in blue?
No, it's I guess fortunate that it's been 50% really almost across all the time. So that was a benefit to retail back in orange, but they stay at 50% really all the way until we get to green. So so that's just that's the one good and the bad of having that flexibility across those other pieces.
And really none of the levels increase beyond 50%, except the caps increase based on the size of the facility, correct?
Right. So there shouldn't be any sectors that are above 50%.
And we're getting questions still. Okay, we're increasing capacities. Are we going to be able to move our yoga mats closer together? Are we going to be able to move our equipment closer together? Are we going to be able to move our tables closer together as we go up the dial to be able to increase our capacities? Or are those still things we're going to have to keep doing even in blue and green?
Under the current dial structure, it doesn't remove the 6 foot social distancing components. So but we do expect in the next month or two an update to the dial from the state. So at that time, potentially there could be a reduction, but that's still speculation at this point.
So back to the 1B3, we don't have clarification yet on what frontline essential employees for manufacturing or food means quite yet. That's what we're expecting from the governor in the next 2 days, correct?
Correct.
And we've been hearing that, that may include office, that may not include office. We need to wait for that clarification before you're able to answer that. And that's where, once we get that information, we will push it out. And we're hoping there's greater clarification, and some of these rumors about which groups will be included and won't be included will also be clarified and better communicated. Yeah, I think I get an email every hour on, I'm hearing this, and I feel bad because I sent it on to Lane, and he's like, we don't have quite yet. That's the governor's press conference. We're still waiting on it. So just know that we're getting those emails, and we're trying to get the information out as soon as we can. I do have somebody with their hand up. I don't have the capacity to be able to unmute you because we do have a lot of people on the call. So if you could put your question in the Q&A or the chat if you're not able to use the Q&A feature. Regarding gyms and indoor fitness classes, where does the guidance stand on the use of stationary fans that blow across multiple participants? This question relates specifically to interior spaces with no opening of windows.
Yeah, the guidance has been not to encourage people to use like an oscillating fan or something in those spaces. It's not going to be favorable to COVID transmission. So, or I guess it would potentially increase that. So they're not encouraged. And it doesn't necessarily mean that you have to open window. It's not one or the other, open windows or put in a fan. Really making sure your HVAC system is working appropriately is really adequate.
And even if you're not getting 5-star certified, we have a really a good checklist on the 5-star site that's an HVAC checklist, and it talks about some of the best practices in the HVAC systems, and then the best ways to increase airflow, some of the best practices in increasing airflow within your facilities. So even if you're not getting 5-star certified, we do have an HVAC checklist on the website that talks about some of those best practices that might be good for people to look at. What proof will be required to get a vaccine if you qualify in the next phase? How is that working, particularly in the previous phases even?
Yeah, I mean, typically the different, so like schools, they have lists of their staff, and so they would just need to bring identification of who they are. They're usually being told where to go for their provider appointments, and so it's being coordinated that way, versus there's some master list the county has of all the people. That's how it's been working with some of the other phases. So I would imagine it'll be consistent with that. So as a business, having the list of your employees, those will probably be important things as at least a step. If you don't already have that, which I would imagine most do, that those will be important pieces to then share, so that we'll have the accounts of how many people, and we'll know when we've gotten through them.
And the next phase does include some medical conditions. So that might be working through your physician also through some of that for the proof within those medical conditions. I'm hoping there's some clarification on that as well, but your physician is probably going to be your best path for some of those pieces.
Yeah, we have a whole host of providers that are ready to do this. So again, it's just a matter of getting the vaccine in their hands.
All right. What other questions do we have out there? So I had a call yesterday from a retailer who had a customer who had just come in to the facility, walked around, left, called and said, I tested positive. It was a customer. So somebody and it was a facility that takes a lot of precautions. Is there anything that retailer or a facility that has people walking through need to do if someone calls and says, I tested positive? That's a consumer, that's not maybe a personal services, but a retailer or a maybe museum or something like that.
Yeah, as long as there wasn't any high risk exposure, so someone that was in close contact, less than 6 feet for 15 minutes, there wouldn't be an exposure real risk there. They should still continue to do the screening of their staff. They should still make sure they have all the messaging and signs up for the patrons not to come there sick. Unfortunately, where most businesses are not screening every person that comes in. Some sectors have that, but not all. So just really that messaging, and then that's really why it is so important, because you don't know who's walking into your place that could be sick, and sometimes they're sick and they don't know it, versus this person who either did know it or went and got tested and found out that they were positive.
I will say that they made an extra effort and found out what bathroom they went in and made an extra cleaning and did some extra cleaning efforts. So I thought that was pretty good. But on the other side, on the personal services side, so if it's a haircut or a massage, that's a little bit different because you're within 6 feet of that customer or that client for more than 15 minutes. So that's going to be a different path you're going to go through than a retailer or somebody just walking through your facility.
And the case investigators should identify those kind of high risk exposures, and then they would reach out to those folks for them to quarantine when they have now been kind of a high risk exposure.
Have you been able to update the mask script to include the vaccinated topic quite yet, or is that something we're still working on?
We've not. We've had a huge challenge. Corinne knows this, that our fabulous communications director has resigned from Boulder County, and so we're in the process of filling that. So we were already backlogged and swamped with communication needs, and now we're down our most vital person. So unfortunately we have not, but I will continue to flag that. So I apologize.
Yeah. No, I think people, Daily Camera, I think or BizWest did a feature article on China on how to be a communications director at a public health department during a public health crisis. It was a pretty fascinating article on, and we thank her for her 20 years of service, and I hope she gets some rest after all of this.
Yeah, I do too. But feel free to just do that yourselves as well. So again, you don't necessarily need the script from us to still make sure that you're stressing that just because you're vaccinated doesn't mean you don't have to wear a mask. So and if you need something to point to, you actually can still point to our public health order locally, as well as the state. So there's no exemption for vaccination for those mask requirements. So again, if you're getting that pushback, you're on solid ground still.
So we got an email from a restaurant asking if there's any additional Boulder County orders that are limiting tables to just two households. Are there any additional Boulder County orders on top of the state orders right now for restaurants, in particular around parties?
No, so it's all based on what the public health order in the dial. So it's based on where we're at in the dial.
So if they're hearing about some other counties that may be really restrictive, those might be local orders that are happening, or those counties might also be in higher levels of the dial or farther along on the dial as well.
Which has definitely been the case, that there has been different statuses across the state. So some counties, specifically resort counties up in the mountains, that were doing much worse. So they could be in a very different place than where we're at.
So just for clarification, I know there was an email that came out from the Colorado Restaurant Association saying to check with your county as to whether or not there's more restrictive. On this webinar, we're making it known that currently there aren't any additional Boulder County orders on top of the state order making that more restrictive.
No, the only things that we have in place that have been in place for a long time now are the mask orders, and then the municipal mask orders.
So, and those mask orders on top of the state order are for outdoor when you can't socially distance. Are there any other questions out there? I'm trying to think of some of the ones I get emailed during the week. So appears that a lot of businesses at like 2:02 p.m. have a question when the call center is closed. Are people responding to the emails after the 2 o'clock if the phone's not available when there's a question or concern or something comes up? What's the best way to get a question answered? Is there a way, or should they wait till the next day if it's unless it's urgent? I mean, I'm happy to answer. I get calls, I get emails. I'm happy to continue to play that, but it feels like it's like right at 2:02.
Yeah. I mean, we have the COVID biz email, so that we have a team that monitors that throughout the week. So it's not just between those hours like the call center. But yeah, the call center, you can just wait till the next day unless again it's something that's really critical. Obviously, if it's something life-threatening, you should really be calling 911. So
Yeah. Sometimes it's like, oh, I just got a call, someone tested positive and they want an answer. So, the COVID biz is a good email address. And then, like I said, if it's something that, you email them, and if you copy me, you copy me as well. It's fine. All right. Any other questions out there? Again, as soon as we have information on the March 5th opening of 1B3, the clarifications, any additions, anything that we have on that, I will send it out. Like we said, we've heard a lot of different things, but we want better clarification before we send out rumors. So we'll send that out. I will send it out as soon as I can, as soon as we get that information. In the meantime, please send us questions, check out the resources that I sent out. I already sent out the Spanish recording for the week, so you have that. You have the links to the state site, the state's vaccine site too, so you can also check on that. You have links to the 5-star site, so even if you're not applying for 5-star, you have links to the HVAC and some of these other checklists. You have links to the order, as well as the capacity levels and your industry-specific information beyond just the capacities, the things that you have to continue to do. Those updates that we get, and if there's order updates, I do send out the changes that come out if they apply to industry. Sometimes they don't, so I don't send them out. All right, well, we'll see everybody next week, and hopefully we have some more answers before then on the vaccine, because it will be literally like the day before the new stage opens. And in the meantime, we'll be around. We have those 2 email addresses and the call center if you have any questions. Thank you. Thanks, Lane.
thank you.